Hello, everyone. It's great to be here. And today we are talking about common conditions in infants or children in their early age, but focus more on infants. So, first of all, I'll be talking about the pink eye, also known as red eye. And what is this? Normally the white part of the eye, known as the conjunctiva, that part is actually the sclera. But the conjunctiva itself is a transparent, part of the eye, the outermost part of the eye. So when this is inflamed, it causes what we call pink eye. Medically, it's known as conjunctivitis. What causes this, you will ask me? So it depends on the age of the child. However, in a newborn, in a child less than 2 weeks, there are many causes. It could be an infection from the mother, like chlamydia, gonorrhea, mostly sexually transmitted infection actually can actually get into the eye and cause some very purulent, by purulent, I mean plenty of pus, red eye. If you have this, please take the child. If your child has this, please take that baby to the doctor immediately because antibiotics are needed. And, this is something that needs to be attacked as soon as possible because there are complications. There can be complications. So another cause is maybe chemicals that are used during birth, or maybe some mild form of trauma that can just cause some small red eye in a newborn. But proceeding to an infant now, there are many types of, there are different causes rather of conjunctivitis, that is red eye or pink eye. It could be bacterial, it could be viral, it could be allergic in children that are a little bit older. So for bacterial and viral, the symptoms are there is discharge, watery discharge, pulsy discharge, especially if it's bacterial, that may cause some sticking of the eye. You see the mom saying, "Oh, I woke up, my child's eye are sticking together in the morning, my baby's eye is sticking together in the morning." And what do you do? Just clean it up with cotton wool. Don't be scared. It's nothing to be scared about. So just get clean cotton wool. You don't want to get it worse. So you want to maintain cleanliness as much as possible. Please get clean cotton swabs in warm water and you try and dab the eye. And once you do that, you continue that cleaning until you are able to see the doctor. Once you see the doctor, what happens? The doctor decides, is this viral? If it's viral, it doesn't need treatment. It will resolve on its own. Is this bacterial? If it's bacterial, you may need eye drops, most likely, antibiotic eye drops or ointments, but please let the doctor decide on what to do. How do we prevent this? If your child has common cold, for instance, that's one of the causes. Common cold is viral. That's catarrh. My child is sneezing. My child has a lot of catarrh. Sometimes they will just clean the nose and take that eye and just take that hand and, dab the eye as well. That is how it gets infected, transmission, cross infection, on the face. So you want to keep the child's hand clean. If the child has common cold, you want to wash that hand. Make sure, the child doesn't rub the nose and use that same hand to rub the eyes. And if you have another child with a pink eye, maybe in the compound or somewhere, or even in the schools, you want to ensure that, that child does not infect other children. So these are the causes, and this is the prevention, making sure that the child's hands are clean and maintaining cleanliness. So this is pink eye or red eye. A lot of times it resolves on its own. If it doesn't, it probably just needs eye drops or ointments, and we shouldn't be bothered or scared as parents. Proceeding to congenital cataract. So that is the second topic we're talking about today. Congenital cataract. We're actually talking about three topics today: the pink eye, congenital cataract, and lastly, I'll be talking about retinoblastoma. Everything, I'll just talk about the main points and what we need to know as caregivers. So congenital cataracts are cataracts that occur in a child that is born, newly born or shortly after birth. What are cataracts actually, you ask me? Cataracts are when the lens is what is that structure, it's just behind the pupil. The pupil is that central back part of the eye. And just behind it is a lens that is supposed to be clear, transparent, to transmit light. It has to be clear and transparent. But if this is cloudy, this is what we call cataract. Cataract spans through all age groups. But now we are talking about congenital cataract. Why would a newborn baby have a cloudy lens, you ask me, it's important to know that it could be one eye, it could be both eye, like every other eye condition, like, like every other, not all eye conditions actually, but these three eye conditions we're talking about today, they could be either unilateral or bilateral. That's one eye or both eyes. So in congenital cataracts, what happens? The child, a newly born child, has a cataract. As a parent, you may not even know that this is occurring. That's why it's important to be vigilant and, I'll talk about the symptoms very soon. So what causes this? Number one is infections. Yes, we're talking infections again. So we see that the eye infections actually have a lot of effects on every layer, every structure in the eye. So it could be infection, but the infection this time is not directly, so just going directly to the child. It occurred while the mom was pregnant. And there are some infections that have been, have been isolated to cause it. There are many of them, but, we have rubella, for instance. Rubella is one that, that can cause this. Even syphilis, chickenpox, you see the mother has, you say, I have a fever or a rash during pregnancy. Chickenpox is another, culprit here. And cataract as well could be from injury, could be maybe birth trauma or even trauma even during that infancy. So you want to be careful of, taking things, sticks or anything that can hit the eye of a child. They do cause cataracts and they have actually seen a lot in children. So these are causes um, of congenital cataract. Injury, maybe shortly after birth, that's the one that will cause that won't be congenital cataract. That would just be a childhood cataract because it wasn't, from the in utero or, it's just something that is acquired rather. So to proceed, what are the symptoms? You will see that this child is probably not looking at you. The child is not blinking, especially if it's bilateral. Sometimes congenital cataracts, a lot of times actually, they are bilateral. It can be unilateral as well. Especially if it's bilateral, you see that that child does not blink to light. You expect that when you shine touch in the light of your eye or when you just turn on the lights, suddenly that child should blink. The interesting thing about congenital cataract is that they may not, they can be sinister. You may not pick them as a caregiver. So that's why early screening is important. So other things later on that it can cause is, the child is looking somewhere else and the one eye is looking somewhere else, the other eye is looking somewhere else, what we call like squint or strabismus. Another thing it can cause, this one is even in infancy, you will see the child's eye dancing, what we call like wobbly eye. It's actually what we call nystagmus. So these are symptoms. How do you diagnose it? Like I said, you cannot, but once you see that there's something, amiss about my child's eye, you take the child to the eye doctor. This time around, it has to be the eye doctor because we have to dilate the eye, look very well, examine the eye to see what is going on here. And early detection is key, for congenital cataract so that we know how to intervene before complications come in. So what is the treatment? Usually surgery is done, but this is not in all cases. Surgery is done when maybe the child is not seeing well with that eye. There's some, the vision is affected. There are criteria that we use to determine if surgery is needed. And once surgery is needed, we do the surgery. Another lens, an artificial lens, that lens certainly has to be replaced. There's no eye drop that can cure this. It's important we know this. So when this lens is replaced, we sometimes the child will need glasses actually because lenses will sometimes see for far or see for near, and then glasses will have to make up for the other. So that's it about congenital cataract. Mostly, what can we do to prevent it? Nothing really, aside the ones that can be controlled, like to avoid infection. Congenital cataract can also be caused by some genetic anomalies, some genetic conditions, for example, like Down syndrome. So that kind of thing, you may not be able to control it. But what you want to do as a mom, for instance, is if you've had a child with a congenital cataract previously, you want to ensure that you inform your GP or your doctor before your next pregnancy that you mean rather during your next pregnancy that I have a baby with this, and if there are things they want to screen for or any genetic counseling they want to do, that will be done to know what to do next to avoid such a recurrence. So that is it about congenital cataract. Now I'll be talking about another important topic, which is retinoblastoma. Retinoblastoma is really important in children because early detection is needed. And, as a parents see it by themselves and they come and say, something is wrong with my child's eye. What is retinoblastoma? It's a cancer, actually, of the neural cells. By neural cells, I mean nerve cells at the back of the eye. And it is the commonest eye cancer. It in itself is not so common. It's actually rare, but it is when you have an eye cancer, that is the commonest cause of eye malignancy. That's tumor. And, it has actually a lot of life-threatening complications. So it's something that we have a low threshold for, we have a low threshold when we are screening. And when you see your doctor screening an infant, those are one of the things we want to rule out in infants. So back to retinoblastoma, it's a tumor, it's a cancer. What does it present as? What are the symptoms? There's something we call the leukocoria, and that is, that's a white reflex. Normally, when you are taking a picture, maybe in a dim light, or you are shining a light looking for something, and you mistakenly shine light in your infant, or in a child, or they are taking a photograph. Normally, the reflex from the eye should either be, you can just see everything black, or most commonly, the one eye is showing this red, there's this red illumination, which is from the blood vessels from the back of the eye, is reflecting back. But if one eye is showing white, if one eye is showing light, that is a sinister sign. That is something that is something that is, gives concern, and you want to ensure that that child is seen by the doctor. It can be unilateral, it can be bilateral. We want to know, you want to look out for that, especially it's mostly diagnosed in children less than 3 years old. So from infancy to less than 3 years old, this is the age where it's mostly diagnosed. You want to be sure that once you see this leukocoria, that's a white eye reflex, pupil, instead of looking, that's the center of the eye, instead of looking either black or red, it looks white. There's this when you take pictures. So maybe you put on a camera, you put on your phone camera and it's shining light, and then you are seeing that white reflection instead of the normal red that's from the blood vessels at the back of the eye. Then you want to get your child checked. If you are not sure of any of this, please, you have an infant, especially children that are getting to 12 months, even above, just get them checked for screening. It doesn't hurt. So aside this, what are the other symptoms? It can present as a simple red eye. Sometimes it can present as red eye. Sometimes it can present as one eye looking in one direction, just like I said for cataract, and the other eye looking in another direction. Sometimes it can present as a bulging eye. It can present as a bulging eye. Sometimes the child can just feel some slight pain in the eye. So these are things that you are concerned about, and you want to get your child's eye checked. How do we diagnose it? When you come as a caregiver with such complaints, or even more, as long as we have, children around this age group in our clinic, we just screen automatically for, such things as cataract, retinoblastoma. Even if you come with something else, or maybe just a simple conjunctivitis, we normally screen for this because early detection is key. So once we pick this, there are different forms of treatments. We have chemotherapy, which is chemical and, drug medications are given to kill the cancer cells, radiotherapy, radiation to kill the cancer cells. We have some focal therapy like laser, cryotherapy, and there is the major one, which is the enucleation, where the eye is removed. However, I want you to note, this shouldn't scare you. If, God forbid, a child has retinoblastoma, at that point, you are thinking of the life of the child. So either you are saving that eye or you are saving the life, because it can't spread to the brain, it can't spread to the spine, it can spread to different parts of the body, it can cause death, So That's why we sometimes remove the eye depending on the stage. Depending on the stage, we say there are different stages of retinoblastoma, and there is a stage that needs removal of the eye. So, but this is not something that you should bother yourself about. What we just want to be sure is early detection. If it's detected early, then we have the more conservative forms of treatments that we use. So early detection has better prognosis for cure, and of course less children would die if it is early detected. And it's a rare condition, but it's very important. And if you have any concerns, just get your child's eye screened. So today we have talked about conjunctivitis, congenital cataracts, and retinoblastoma, things we can see in infants and even early child, very early childhood. And as parents, what is our duty? To just look out for these conditions, anything that we can do, especially for pink eye, you want to give supportive care, clean the eye before, you visit the doctor. But let us let us be vigilant for this and get help when needed. Let's not listen to any myth on, oh, let's do this, so that we don't present late to see the doctor when complications have risen. Thank you so much for listening. It was great being here once again. And yes, I'm Olapeju Sam-Oyerinde, and it was great being here and talking about these three common eye conditions. All right. Have a good day. Bye.